If this is your first time in Kebbi State, you can easily forget about the insecurity plaguing the state and be lured into watching the beautiful landscape, culture, and million-naira bucks strolling on the streets with their guides giving us an opportunity to appreciate God's gift to mankind. A thrilling moment for me and my new spectators. Known as the land of equity, Kebbi State is struggling to live up to its name. Not everyone has access to basic amenities like good roads, potable water, education, and healthcare. Irregularities in the health sector have caused a lot of hardship for medical personnel and those in rural communities of Kebbi State.
The primary health care, the other health services management are what I will call toothless bulldog that can only bark but will never bite. I'm telling you this. What are they doing? No one will do anything.
Wow.
I'm telling you this.
So we suffer in silence.
That is what we have been doing. We have been suffering in silence. Somebody working on grade level 9 is getting 29,000 naira as a salary. 29,000 naira, not even up to 30,000 naira as a salary, and this is grade level 9.
Grade level 9.
Level 9, receiving less than 30,000 naira per month.
Wow.
If you go for promotion, they will tell you to bring 5,000 naira to be promoted. When you give the 5,000 naira, you will be promoted. When you go for the promotion to be implemented, they will tell you to bring the 5,000 naira, and they will implement. They will give you 30,000 naira, an increment of 30,000. You are paying 5,000 naira, but you get to get 30,000 naira. What does that mean? That is why I even decided not to follow any promotion any longer. I've been on level 9 since 2013.
Although the government has promised to improve the quality of healthcare in the state by renovating dilapidated buildings, it's not yet uhuru as the search for health workers and adequate supplies continues. As alleged by some health workers, we decided to visit some communities in Kebbi to check the condition of the workers and facilities they are using for patients.
Yes, this is the only one that we treat our clients. Yes. The next one is our store, while this is the consultation room. Antenatal care attendants, clients are treated here. It used to be our store, but we converted it into, because in the absence of good, we say fear can serve. So we converted it into our ANCs and family planning department.
The Zauro Health Center, Birnin Kebbi, is almost unnoticeable, with the inscriptions on the wall fading out. The 30-year-old structure is falling apart under the pressure it undergoes daily. The officer in charge, Farouk Usman Birnin Kebbi, sits in his 3-room facility, unsure of what our visit will bring. Intermittently, our conversation is disrupted by the pains and cries of patients waiting for Farouk Usman's diagnosis or referral to the general hospital. As a health worker who has spent more than 15 years in practice, there is no need talking about better welfare packages, promotion, or remuneration. All he is interested in is how we can help the community rehabilitate the facility.
Lack of water. We're in desperate need of water supply. A child was brought with high fever. There is need for sponging. There isn't a single drop of water to sponge him. We are surely going to refer him to the referral center because it was a case of high fever. But all the same, there are things we need to do to assist him before going to the referral. But there wasn't water, at least to sponge him. So there is nothing anyone can do. We have to send somebody to the neighboring houses to get water, the little water, to sponge the boy. We did it, called Sokan. He got the water, we did the sponging, we gave him a test net, and then we referred him to the health facility, to the general hospital. So I think water is very important. Without it, I think nothing is possible. Everything will collapse without water. We have an attendant here, ward attendant, that used to go to the tap to get water for us.
Monthly, an average of 150 to 200 pregnant women come here for antenatal care. There is no labor room or consultation room to accommodate the numbers. The mats outside serve as an extension of the facility.
It's an Islamic school, a Majlis school, yes. They are now going into the town in search of what to eat. I hope you are living with this.
Another concern is the Almajiri school beside the facility. There are cases of scabies and schistosomiasis from the children. Farouk fears an outbreak because the Almajiris mingle with other children in the community. Even the Almajiri school is not conducive for the children. During the COVID-19 pandemic, the health assistants traveled to the local government office in town to get vaccines. Till now, they still make the same trip downtown for vaccines.
We are conducting an immunization sessions. We come directly with the vaccines from the main store, that is at the MPI office in Kebbi. When we finish, we also return back the vaccines. So the next 2-3 days again for the outreach session, we also bring vaccines from Kebbi down here. After the session, then we take it, the remaining that are not exhausted back to the store.
So same thing happens.
This is due to lack of the immune refrigerators. Yes, no storage facilities, vaccine storage facilities. So we think that is the only way we can get potent vaccines because we don't have any facilities to store them. So we normally go to the MPI office, get our potent vaccine, come back here. After immunization, we also return the vaccines that are not exhausted back to MPI office.
Who pays for that transport?
We pay for it. Because as an RI provider, you must go and get the vaccines. Nobody cares to give.
And so who is funding that? Is there like a fund set aside to
There
cater
isn't.
to transportation?
I'm not aware of that.
The Ward Development Committee is trying to build a labor room for women in the community, but Farouk and his team needs more. They want pipe-borne water due at the facility, more wards to accommodate inpatients, a midwife and medical equipment to get their makeshift laboratory running.
Insecticide net was the time it was constructed some 4-5 weeks back during the distribution of the long-lasting mosquito net. That was when it was constructed. But it is yet to be put to use.
With whose fund?
With the fund that we are getting from the, how do you call it, PSC fund something.
Yeah.
Yes, basic health, yes, basic health fund, yes. We constructed this we also repaired this because when it rains, there isn't any difference from here and outside. That water is everywhere, but we use part of that fund to repair this place, to construct this.
There's nothing in the lab. Not too far from Zoro, Birnin Kebbi, is Makera Health Center, opposite Tasha Zabu. This is the road that leads to the primary health center in Makera under Birnin Kebbi local government area of the state. From what I understand, this road construction has been on for about 2 years now. For now, residents can use this road to access the health center, but when it rains, it becomes a bit difficult. For years, residents have waited for the completion of the road project. During rainy season, residents have to walk a few meters away from the road to this point where I'm standing, and thereon they use this elevated spot to access the health facility, all the while taking in and soaking in the stench of feces buried in the bush. We were lucky enough to come to the facility during the dry season. Like most patients, we sit outside the health facility, waiting for the officer in charge to talk to us about his daily struggles as a health worker.
Muna dan ba ku hankuri da dan rike ku da mun kai saboda kun taho ga kuma babu lafiya kuma gashi mun tsaya muna dan attending baki. Ba a ci da
For Mubarak, it was difficult to give COVID-19 vaccines to the 17 communities because the people were hesitant.
In doing that, we have more challenge because people are saying that the more you take the vaccine, you will no longer last for more than a year. You will die. You know, that one is a big issue. But we still continue as educating them that even us, we have took the vaccine. If it is harmful to us, we will not take the vaccine. But even us, we take the vaccine, more we are okay. We do that, then they cooperate, then we vaccinate, then we continue educating them.
Mubarak is looking forward to having a live-in midwife at the facility to help with the work at night.
There is, because in this facility we are lacking lab. We don't have standard lab that will diagnose and see the issue of people. We just have a small place that we assigned as a lab, but we want a room that will be standard as a lab to us, and we don't have a unit of family planning. We are liking those ones. Besides those ones, so there are some issues. Our staff quarters, we need help on that so that they can renovate those, because the issue of those staffs, when they bring another some people, they will say that the place is not convenient for them to stay. Like midwifery, we want a midwifery that can sleep here to attend some issues about labor cases, but they won't stay. It's only me that will stay because me, I'm living here always the time. They will just we need the assistant.
Suru local government is one of the 21 local government areas of Kebbi State, northwest Nigeria, with about 40 health facilities for a projected population of 253,700. Our attention is drawn to one of the dilapidated health facilities where one man works tirelessly to cater to the health needs of his kinsmen. We are in Bandan, a settlement that has enjoyed the services of one medical personnel who has stayed at Tindefe Health Post for 11 years, against all odds, on favorable conditions, using medical supplies he can lay his hands on to treat patients.
Charge na wannan asibiti shekara 11 da suka wuce. Alhamdulillah, ko da nazo wannan asibiti tana aiki sosai, sannan akwai ƙauyuka gewaye da wannan asibiti da ake ce ma.
I have been in charge of this hospital for more than 11 years now. When I got here, the hospital was a bit manageable. This is where sick people wait. If someone goes inside and comes out, another will go in.
Mata ki kwance domin haihuwa din. To sanadiyan nan ya lalace sai muka cire asibitin, muka cire gadon muka mashe shi can waje. To yanzu dai kun ga yanda waje yake.
So the room that we're about to enter now is the labor room. First of all, before things got this bad, we used this place as a labor room. But because we can no longer use this room, when a pregnant woman comes, we take her to the other room, fix it, to make it conducive for the patient. That's where the nurse will check her. And if the time is not due, we will wait. But if the time is due, the necessary things will be done, and by God, she will give birth to our baby safely. From there, the nurse will give her the necessary medication. But now the hospital is an eyesore. The issue of giving birth is no longer here in this hospital. We are calling on the government to help us rehabilitate the facility. They should check the hospital's condition and help us. They should help the people that are coming here to give birth, because we have over 5,000 people using this hospital. And we also have about 8 villages around. They also come to this hospital to look for treatment. We use this hospital for antenatal care. This is the bed the women lie on for the delivery. But because this place is spoiled, we removed the mattress. You see how the place is. We can't bring a pregnant woman here. Sometimes when the woman is in labor, we go to their houses to help deliver the baby. You see, because of how the hospital is, we are in need, and we are begging government and any other agency to help us and rehabilitate this place. This is the ward. We put drip and other things on the bed because all our tables are spoiled. We brought our medicines here. This room is used as a ward and consultation room. The patients we are supposed to admit, we admit. The ones with mild conditions, we tell them to go home. These are all the drugs we have to help the sick ones. Look at this chair. It's even tied. But we thank God for the way things are. At least we are managing what we have. Then this one, it's a new solar that was brought to us during the summer season. It's 2 years now since they brought it. It's not working. But when it was working, we used it to store vaccines for children. This was useful for us during routine immunization for prevention of sickness for children from 0 to 5 years. If we need vaccines, we go to the other facilities far from here. That's where we go to collect the RI medicine to give the children from this village and other villages surrounding the place. We have many children that usually come here. In a day, we get about 30 people or more than that. We have to get a motorcycle or pay for one to get drugs for children. Inside the preventive treatment that we do the one that is called VCG, PCB, measles, yellow fever, and DPT. All these are treatments that we render here at this hospital every day. Formerly, in a week, we do it twice, but now, almost every day we get children and pregnant women that visit. So we give them the vaccine. We also give COVID-19 vaccines.
On the hospital book, this facility is listed as a health post, but in reality, it has become inhabitable over the years, with no ceilings, beds, drugs, electricity, and medical staff. The building looks deserted.
Samun matsaloli na asibiti saboda kasantuwan asibitinmu ya lalace sosai, to mafi yawanci mutanen gari suna kuka.
We have issues with our hospitals because it's in a very bad condition. Our people have talked about the situation for long because going to Badon Health Facility is difficult for us. We want government to please rehabilitate our hospital so we can get quality healthcare services. Due to poor condition of the hospital, someone came from town who is not a physician and opened a small shop serving as health facility. People now troop to this place seeking for health service. Here, we have patients suffering from malaria as a result of mosquito bites, measles, and malnutrition, but our hospital can't help them. If someone comes to get treatment, they will see that the place is in a state of disrepair. Instead of getting well, they're getting worse. That's why there's a reduction in the number of people that visit the hospital. Before, we normally get above 30 a day, but now it's between maybe 10 to 15. That's why we are calling on government and other charity organizations to help us repair the hospital so the people can get the best treatment. We have 3 laborers and 6 health workers here. We used to administer COVID vaccine, and we did it. Except that when they said they would pay, they didn't pay, which was close to like 3 months without any explanation. That's why we suspended it, sincerely. They have not paid.
This space functions as a multi-purpose ward for patients. There are just 2 beds in the room. One is being used as a drugstore and consultancy space for Yakubu, while the other bed, which was initially for pregnant women, is now for examining outpatients. Administering COVID-19 vaccines has been difficult for the health workers. Unpaid allowances frustrates the process.
We have 3 laborers and 6 health workers here. We used to administer COVID vaccine, and we did it. Except that when they said they would pay, they didn't pay, which was close to like 3 months without any explanation. That's why we suspended it, sincerely. They have not paid.
So now they've not paid you? Weeks after our visit to the facility, the government has started renovating the place, but no word on employing more workers, unpaid COVID allowances, or salary increase. And that wraps it up on this edition of Community Forum. Don't forget you can watch this episode, previous or subsequent episodes on our YouTube channel. You can also invite us to your communities, talk to us about what you want the government to do for you. My name is Sarah Yuku, and from Kebbi State, bye for now. So let's try this. Tell him to, let's try it. Hey. Hey. Woo! Oh my God! Oh my God!